Now, first at last, there's something in this election campaign that touches you direct. Forget about the Labor frontbencher and his sleazy dealings with negative gearing, exploiting it at the same time he's bagging it. Forget the immigration minister attacking refugees. That's all sideshows. This matters directly to you. Malcolm Turnbull has frozen the Medicare payments. He did that in the budget till 2020. Now, I told you the day after the budget, this would increase the cost of going to the doctor. It's a co-payment by stealth. The doctors are asked to carry the cut, really, and many of them are not able to. So if they bulk bill, it costs some money, so they have to charge you. They'd have to charge you more. And not a lot of doctors, particularly GPs, are paid a lot of money. But today, and this is where I say it touches you, the Labor Party's got an option. They will lift the freeze from next year if they're elected, and that should mean, if you trust the doctors, it should mean your doctors' bills do not go up. But what is the cost? What do you pay elsewhere? And you have to pay somewhere. It's going to affect the tax cuts. It's going to affect people getting a baby bonus, single income people, not fat cats. It's going to affect people borrowing money for VET courses. The money has to come from somewhere. That's part of my point. Now, the Shadow Health Minister's Catherine King, I recorded an interview with her because she was about to climb on one of those campaign buses in New South Wales. And I began by asking the Shadow Minister, Catherine King, if she had a guarantee from the doctors that if she did this, they would in fact extend bulk billing.
Well, I'm pretty confident that doctors will maintain bulk billing rates. I've been talking to the College of General Practitioners and the AMA. What I absolutely know is if this freeze is not lifted, we will see bulk billing rates drop. We will see patients on concession cards having to pay more to go to see a doctor. The doctors are saying very clearly this is a tipping point. They've been pretty patient. I think they've tried to work with the government on reform in primary care, quite rightly. They felt that the pause on the Medicare benefit schedule, the freeze was going to be lifted. They had a nod and a wink that had happened, and as a shock to them in the 2016 budget was extended out to 2020, and they've said enough is enough. They will start having to charge patients, and frankly, we want to stand up. The Labor Party wants to stand up for Medicare and patients and end this freeze on the 1st of January.
We do accept, I've been reading the rhetoric about how awful the freeze is. Labor actually introduced it, admittedly only for 9 months, but you did introduce it yourself.
This freeze ended in July 2014. If you remember, the debacle the Abbott-Turnbull government got itself into with the GP tax on December 2014, it suddenly announced it was going to extend, have a 4-year freeze on the Medicare benefit schedule, and again in 2016, which frankly was a shock to all of us. They decided they were going to extend it right out to 2020. So this is all Malcolm Turnbull's own work, a decision that they have taken, and frankly, it will see the end of universal Medicare.
Are you able to guarantee to patients that they won't have to pay more to go to the doctor?
Well, that, of course, is going to be up to doctors. What we are backing in today, very, very clearly, is that we believe, and we've listened to the doctors, we've listened to Patients Consumers Health Forum as well, that if we don't do this, we will see patients pay more to go to see a doctor. So we are backing in.
I'd agree with that, but you can't sort of guarantee the reverse, can you?
Well, we can certainly make sure that we have a universal, affordable system for people to go and see general practitioners, the most affordable and efficient part of the system where we want people to go to stay well. So what we are trying to do today is to make sure we are backing primary care, we are backing patients, and we are backing Medicare.
Okay, and then it gets down to the difficult bit. What's it cost?
It does cost $2.4 billion over 4 years, which is fully funded out of the savings measures that Labor has already announced. And again, this is about priorities. Malcolm Turnbull has decided tax cuts to multinationals are more important than Medicare. We believe Medicare is more important.
Don't you believe tax cuts to, and it's not just multinationals to be fair, don't you believe a business tax cut could in fact promote business and create jobs?
Well, this is all about choices, and I think this is a pretty stark one that we've got here.
What, health ahead of jobs?
Well, if you can't be healthy, then you can't work. So, frankly, I'm pretty sure that absolutely making sure that we have a strong Medicare system, that people can continue to have universal access to Medicare, this is a choice. Do you put taxes to multinationals? And that's what Malcolm Turnbull's decided to do.
It's not just multinationals.
Backing Medicare.
It's not, to be fair, it's not just multinationals, is it?
Labor's backing Medicare.
It's not just multinationals, is it?
Well, of course, there is also the tax cuts to small business, which they wanted to redefine as turnover of over $1 billion. So, frankly, we think this is, again, about choices.
But
is this about Medicare and making sure you maintain Medicare, or is it about do you want to do that? And so we fully funded it out of those savings.
But let's just accept the reality, though. It does affect Australian business as well, not just multinationals, doesn't it?
Well, sure, but in our view, absolutely, the choices and the priorities that Malcolm Turnbull has decided in this election campaign is that versus Medicare, and we're backing Medicare.
So what tax cuts are you actually doing away with?
As you know, in terms of the savings measures that Chris Bowen has already announced, that they include improvements to the budgets on not proceeding with the new baby bonus, capping the vet fee helplines, and not proceeding with the tax cuts for multinational companies.
They're not just multinational. But what tax cuts? Are there any tax cuts for business or not? Are you doing away with all of them?
No, as you're aware, we have already said that we will support small business. We do believe very firmly that we want to promote small business, but our definition of small business is the turnover of $2 million, which has been the long-held position, and we don't believe that the government's proposition that a small business has a turnover of $1 billion, that is a small business. So it is part of those savings that, of course, will contribute to making sure we have a universal health insurance scheme, Medicare, and that we continue to have that into the future.
The government's plan on tax cuts was spinning out 10 years. Is this a 10-year commitment from Labor, saying no tax cuts for 10 years?
In terms of Medicare, which is what I'm talking about today, in terms of Medicare, we are announcing a $2.4 billion initiative to back in primary care over 4 years, and it has also been costed over the 10.
At $12.2 billion?
That's correct. And
so
again,
does that mean the tax cuts are ruled out for 10 years?
No, that's not correct, and I'll leave it to Chris Bowen, our Treasury spokesperson, to talk about tax cuts. I'm our health spokesperson, and today we're backing primary care, we're backing patients, and we're standing up against Malcolm Turnbull's GP tax by stealth.
Okay, what about the $1,000 bonus to people with single income owners, isn't it, with single income earners with a child under one?
Yeah, again,
how many people will that affect?
So again, that's a matter for Jenny Macklin. She's been out there talking about that. But we don't think that reintroducing, in essence, a baby bonus is a priority at the moment. What we believe is a priority today is making sure that people can continue to access general practice. We've got GPs across the country saying this is the tipping point. They will start dropping bulk billing for concession patients. So we are saying this is a matter of priorities.
I understand that, and I agree with you that it would have led to an increase in the Liberal plan could well lead to an increase in what people pay for the doctor. But we've then got to look at what it costs. We've looked at the tax cuts. The $1,000 bonus for single income earners isn't a fat cat thing, is it? That's going to people who need it.
Well, again, these are the savings measures we already announced. We announced those on just after budget night. These are the savings measures that we have said we won't back, and this is where we're going to put the money to, making sure we have a universal health insurance.
So how much specifically will you save on that $1,000 bonus for single income families, for baby bonus?
Again, I don't have that figure in front of me. I'm focused today on the announcement that Labor has made to make sure that we actually have a universal health insurance system and that we have an affordable access to general practice.
Do you have the figures that show us the cap that you'll be introducing on VET fees for students, on loans for students? Do you have the figure?
Again, I don't have all of those figures in front of me right at the moment. I'm in a hotel room in Sydney, but I am here making sure that Labor's commitment to ensuring that we have good, affordable access to general practice. It is fully funded, the announcement that we have made today, out of the savings measures we have previously announced.
Why do you think that bulk billing rates have increased despite the freeze?
What we've seen from doctors, I went over to WA to have a chat to the President of the College of General Practice, is they believed that what the government had told them is that the freeze would be lifted pretty quickly. They held in there. They said, OK, well, we'll try and maintain bulk billing rates. We'll try and get some reform in primary care because the government has given us a nod and a wink that this is going to be lifted. They were pretty shocked on budget night, frankly. You would have seen, if you were just looking on the Twitter feed on budget night, GPs across the country were absolutely white-hot angry that they had been basically betrayed and had the freeze extended to 2020. They have said enough is enough. They won't be able to continue to afford to do this. They don't want to. We want to see bulk billing rates continue to stay high across the country. Of course, we want to see it rise in a number of areas where it's still pretty low. But this is really the tipping point. Patients will pay. And, of course, this has been what the government's been trying to do from day one.
So the pressure's back on the doctors. The doctors have got to do the right thing, correct?
Absolutely, and I am absolutely confident when it comes to Medicare, I will back doctors over the Turnbull government any single day.
Thank you very much for your time.
Really good to talk to you, Neil.
Thank you. The Shadow Health Minister, Catherine King.